Good evening, wherever you are. This is Riley Knox from ConferenceHype. Our segment will focus on lymphocyte subset reconstitution and clinical outcomes following haploidentical hematopoietic stem cell transplantation. From the 2026 May edition of British Journal of Cancer. Background: immune reconstitution is critical for outcomes after allogeneic hematopoietic stem cell transplantation, but its prognostic role in haploidentical peripheral blood stem cell transplantation remains unclear. Methods: we retrospectively analyzed 577 patients who underwent T-cell replete haplo-PBSCT between 2016 and 2024. Results: early and robust regulatory T-cell reconstitution significantly reduced transplant-related mortality and improved overall survival. Discussion: distinct lymphocyte subset reconstitution profiles predict transplant outcomes in haplo-PBSCT. From the 2026 June edition of British Journal of Cancer. Tumor-infiltrating lymphocyte therapy offers the potential for durable clinical benefit in select patients with advanced melanoma, especially after progression on treatment with immune checkpoint inhibitors and/or targeted therapies. 2024 FDA approval of lifoleucel, a commercially manufactured autologous TIL product, marks a key milestone in integrating advanced therapy medicinal products into routine care for solid tumors. Health Canada has since approved lifoleucel, with regulatory and funding decisions across the UK and Europe still pending. In this perspective, we review the evidence base and outline key considerations for national adoption of TIL therapy. Despite promising results from clinical trials, TIL therapy requires complex coordination, including patient selection, tumor procurement, manufacturing logistics, lymphodepletion, and IL-2 administration, all contingent on specialized infrastructure and well-considered integrated care pathways. From the 2026 May edition of British Journal of Cancer. Background: P21 activated kinase overexpression, phosphorylation, and gene amplification have been reported to increase cellular invasion in ovarian cancer, worsening patient prognoses. Methods: PAK and PDL1 expression in ovarian cells was determined. Results: OVCAN cells showed significant sensitivity to PAKI. Discussion: the work presented here demonstrates the efficacy of PAK inhibition and PD-1 checkpoint blockade as a combination therapy for high-grade serous ovarian cancer. From the 2026 May edition of British Journal of Cancer. Background: colorectal cancer exhibits distinct bacterial community compositions compared to healthy mucosae, which intimately correlate with CRC clinical outcomes. Methods: FISH experiments and 16S rRNA sequencing were conducted to determine the inducements of various bacterial colonization within tissues. Results: colorectal tumors exhibit heterogeneous and individualized preferences in constantly remodeling intratumoral bacterial flora. Discussion: individual evaluation of the preference of tumors in microbiota may pave the way to the development of CRC therapeutic strategies, and Provotella is an emerging genus worthy of clinical attention. This concludes ConferenceHype's coverage of the May 2026 issue of British Journal of Cancer. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X@ and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 May edition of British Journal of Cancer. Background: germline genomic sequencing is increasingly offered to children with cancer. Methods: Using a convergent parallel mixed methods design, parents and children completed questionnaires at baseline post-consent, results return, and for parents, 1 year post-enrollment. Results: 187 248 parents and 1932 children from 128 144 families participated. 49 parents were interviewed. Discussion: consent for trio-GGS at cancer diagnosis is complex, requiring flexible, tailored processes. From the 2026 June edition of British Journal of Cancer. Rhabdoid tumors are malignancies of the central nervous system, kidneys, liver, and soft tissues that most commonly affect very young children with survival rates below 30% in high-risk cohorts. Treatment entails surgery, intensive chemotherapy, and radiotherapy associated with substantial short and long-term toxicities. There is an unmet need to develop targeted therapies for RT to improve patient outcomes and mitigate the toxicities of current therapy. Detailed research, followed by a workshop, had the objective of enabling the development of targeted therapeutics for RT. Given the inherent commonality of their biology, the therapeutic approach should be similar for intracranial and extracranial tumors. DDB1-CUL4, associated factor 5, is a promising target, and the development of small molecule binders degraders is a priority. From the 2026 May edition of British Journal of Cancer. Background: mesothelioma is an aggressive malignancy with limited therapeutic options. Methods: OGLC-N acylation levels were examined in mesothelioma samples and cell lines, and OGLC-N acylated proteins were detected by mass spectrometry. Results: OGLC-N acylation was markedly increased in mesothelioma cells with Hippo pathway inactivation. Discussion: these findings demonstrate OGLC-N acylation-driven enhancement of nuclear export as a therapeutically actionable vulnerability in mesothelioma with inactivation of the Hippo pathway. From the 2026 May edition of British Journal of Cancer. Background: timely surgical treatment is critical for optimal breast cancer outcomes, yet delays in care persist. Methods: we conducted a retrospective analysis of BC cases diagnosed between 2007 and 2021 using Insight Clinical Research Network data. Results: surgical delay occurred in 10.7% of lumpectomy and 25.3% of mastectomy patients. Discussion: this large, multi-institutional study reveals persistent disparities in timely surgical care. This concludes ConferenceHype's coverage of the May 2026 issue of British Journal of Cancer. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of British Journal of Cancer. Background: prostate cancer is a leading cause of cancer-associated death in men worldwide. Methods: established and primary prostate cancer lines were treated with the CFLIP inhibitor, OH14, in combination with recombinant trail to investigate changes in viability and colony-forming potential. Results: combined OH14 and trail treatment induced a potent apoptotic response in prostate cancer cells, significantly reducing viability and CSC activity compared to single agents. Discussion. Inhibition of CFLIP in combination with either trail or docetaxel has the potential to be used as a novel therapeutic approach to provide more potent, long-lasting benefits to men with prostate cancer. From the 2026 May edition of British Journal of Cancer. Background. This study aimed to elucidate the impact of systemic shifts towards increased oxidative or antioxidative potential on cancer development and suppression. Methods. We designed a case cohort study within a large Japanese population-based prospective study. Results compared to the lowest quartiles. The highest quartiles of DRAM showed a multivariable adjusted HR of 1.69 for hepatocellular carcinoma and 1.32 for lung cancer. Discussion. These findings suggest a potential impact of oxidation and antioxidation on cancer development at specific sites. From the 2026 May edition of British Journal of Cancer. Background. Patients with locally advanced breast cancer undergo staging tests. Methods. A prospective cohort study in patients with ILBC and TNM stage 3 or IB was conducted contemporaneously to the RCT. Results. Between December 2016 and April 2022, 41 patients with ILBC were enrolled, 38 undergoing all three imaging tests. Discussion. In this cohort, 18F FDG PET-CT detected all cases of metastatic spread. From the 2026 May edition of British Journal of Cancer. Evidence from conventional and Mendelian randomization epidemiological studies support the conclusion that obesity is causally associated with increased risk of several common cancer types. Some evidence, notably from quasi-experimental bariatric surgery studies, support the concept that sustained long-term weight loss in individuals is associated with reduction of cancer incidence, particularly in women. Yet, there are no authoritative public health policies directed specifically at large-scale weight management interventions to prevent obesity-related cancers. At least two adversities conspire against public health success: awareness of the causal link between obesity and cancer risk, and lifestyle interventions are associated with only moderate weight loss that is generally not sustained long enough to result in clinically meaningful cancer prevention. This concludes ConferenceHype's coverage of the May 2026 issue of British Journal of Cancer. Did we miss an article or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.
This concludes ConferenceHype's coverage of the May 2026 issue of British Journal of Cancer. Did we miss an article or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast. This is Conference Hype. Stay with us, coverage continues.